Hello, my name is Carlos Salazar. I'm the Language Services Coordinator for Erlanger Facilities. I work under the Diversity Department, and we run the language services along with diversity issues. So our learning objectives today is be informed of the organization's diversity program, increase awareness and knowledge of cultural differences, be aware of communication and language tools available at EHS, and increase awareness of disparities in healthcare. This is a diagram of what we are involved in as far as our diversity program. We do have a diversity strategic plan. We do try to be available into the community, and mainly our goal in the community is to present Erlanger in such a way that everyone wants to first come to Erlanger. We also train our staff, and we train externally and internally to work with the different diverse programs of Erlanger. What is diversity? Diversity refers to any collective mixture of differences, similarities, and related tensions. If you notice characteristics of two people, in these two pictures, we have two people, and just by the appearance, what do you notice? You can ask yourself, what is it that the difference of these two people? What can you tell based upon these appearances? So what is visible? Gender, age, ethnicity, race, and I disagree with this last part, physical or mental ability. We don't know based on this picture what their mental or physical ability is. Less visible, their language, culture, thinking style, politics, national origin, and or religious beliefs. So cultural competency is the cultural competence is defined as the ability of providers and organizations to effectively deliver health care services that meet the social, cultural, and linguistic needs of patients. After all, that is why we're here. Why do we need culturally competent health care? A culturally competent health care system can help improve health outcomes and quality of care. It can contribute to the elimination of racial and ethnic health disparities, and it can reduce linguistic barriers to patient care. Some of the cultural influences that we experience are things like stereotypes. Stereotypes is a fixed, oversimplified opinion or belief about a group of people. And generalizations is an idea or belief that is applied to an entire group of people. So aggressive medical treatments when treating ethnic groups, this is why even though we all do this, we all stereotype, we all generalize, but we have to be careful when it comes to medical treatment. So inclusion, we encourage inclusion here at Erlanger. Inclusion is creating and maintaining an environment that naturally enables all participants to contribute to their full potential. Everyone has a special talent, everyone has something to bring to the table, and everyone has something to contribute. So, the LEARN guidelines. We listen, we explain, we acknowledge, we recommend, and we negotiate. So that's the acronym for us to work together. Explanatory models. And the explanatory model, it's very important that a patient understands what is going on. So the patient's understanding of the cause, severity, and prognosis of an illness, the expected treatment and how the illness affects his or her life, and it also has to be culturally determined, what a person believes or feels about such an illness, eliciting the patient's beliefs about their health condition. So in my experience with people that are not from our country, they have their own beliefs and about their condition. And in my experience, when it comes to me, I always feel like when there's something wrong with me, it's got to be the worst thing in the world. For instance, I was experiencing dizziness, so right off the bat, my understanding of all this was I have a brain tumor, which I really didn't. It was just vertigo. So a patient needs to understand the cause, severity, and prognosis of their illness. Now we go to interpreting services at Erlanger. We have different types of interpreting. We have face-to-face, where you have an interpreter present. You have technology, and you have training for different people that work here at Erlanger. So the face-to-face involves, first of all, American Sign Language. We contract two companies, two local agencies here, that when you call them, you will schedule interpreters to come for patients who are deaf or hard of hearing. That will bring someone out there. Now, if it's in the middle of the night, a weekend, and they are not available, then we have technology. And we also have on-site Spanish interpreters because Spanish is our biggest market. So when the physical interpreters are not available, we go to technology. For the deaf and hard of hearing, we have video remote interpreting. It's called a VRI for short. And it's a laptop where you can dial into a live interpreter on the screen so that you can communicate with your deaf or hard of hearing patient. We also have a language line that supports over 200 languages. Last time we counted, I believe it was 278 languages. And then we track all of that real data so that we know what our needs are. We also train and educate clinical and non-clinical staff on how to use them as interpreters, not as a full-time job because they have their own jobs, but just to help facilitate communication when it's necessary. Healthcare literacy. Healthcare providers connect with patients, clarity of communication between patient and provider, and language barriers. And then what is a reasonable accommodation? We're supposed to provide interpreters with reasonable accommodations. So patients of Erlanger Health Systems who are limited English proficient, and that is the term used, or short, the acronym LEP, deaf and hard of hearing, shall have services provided to them in their primary language during the delivery of all significant healthcare services. So this means that anytime a physician is talking to them or you're giving them medical instructions or education, they need an interpreter. If by any chance you're asking them if they're cold, they need water, or anything that's non-clinical or not significantly clinically communicating, such as a blanket or things like that, then you don't really need an interpreter. Language access services shall be available within a reasonable time at no cost to the patient. So we cannot charge for this service. So when to call an interpreter? Anytime a patient has limited English proficiency, if a patient speaks some English but is not fully fluent, this is limited proficiency, and an interpreter must be called. Many times a patient will speak enough English to communicate in many situations outside of the hospital, but will lack the vocabulary and skills necessary to communicate in a medical setting. Family members. Even if a family member that speaks fluent English is present, an interpreter must be called. Family members cannot be used to interpret. And part of that is because, well, there are several reasons. One is HIPAA. Two is you don't know what the family member is saying. You can't trust that they're telling the family member everything. And in my experience, if you give someone devastating news in some Spanish-speaking cultures, they will just say you're going to be fine, and they're really not. So this is why you need a professional interpreter. This is especially so for children and teenagers, since it can be traumatic for them to interpret many hospital situations. I have seen, for instance, situations where mothers are coming to have a baby and they bring their little child because they're the only ones that speak English because they go to school. And so you cannot ask their children anything about STDs, abuse, or any of those personal questions, and you don't want to subject family members, especially teenagers or children, to that. Family members may not be proficient enough in English to interpret accurately. Even if they are fluent in English, family members may not interpret everything that is said. Family members should not have to interpret while also being there emotionally for their loved ones. Interpreting is not their job. This is our algorithm from the Diversity Department and Language Access. If you go to one side, you see the deaf and hard of hearing and who to call. And it's the link number 5465 in the hospital, and they will get in touch with the agencies to provide you a live sign language interpreter. If it is a limited English proficient patient, then there's the algorithm of how to go about it. If you need to go with a telephone or you need our services here on campus, you can contact our dispatch number at 4025. These are our VRIs, or Video Remote Interpreter Computer laptops, to be used for the deaf and hard of hearing patients. The VRIs may be used for spoken languages if the communication via the language phones is unsuccessful, or the patient requests an in-person interpreter and no staff interpreter is available. You can call 7614 to check out a laptop, and that's the hospital security department. They will not bring the laptop to you. You have to go down there and sign it out. So you follow the instructions on the laptop to set it up, and then you use the computer, but make sure that you're set up before you go into a patient's room. It's very disconcerting to a patient who feels like we are not adequately functioning when it comes to communicating with them. These are our language tools. The dual handset phone, you can use those in hospital rooms where there is a hospital phone. You can just disconnect that and use this one. So you have a dual handset phone, you dial the number, they'll ask you what language you want, you tell them, and it's very simple. The dual handset cordless phone is usually used in a clinic setting. The base, however, has to be plugged into a fax line. And the dual handset cordless phone has only about a 20-foot range. So the video remote interpreting laptop works on our Wi-Fi, and as you can see, there is a speaker, so you don't have to get in front of the computer and speak to the interpreter. They can hear you just fine. So this is why we do what we do. Title VI regulation. Per Title VI of the Civil Rights Act of 1964, all federally assisted programs, and that is us, must provide reasonable accommodations for participants with limited English proficiency. This means any provider who receives federal funds by law must provide interpreters at no cost to their patients. Compliance with ADA requirements. This also falls under the Civil Rights Act of 1964. The definition is Americans with Disability Act. It gives federal civil rights protection to individuals with disabilities by law. Disabilities include impairment of one or more of these major functions: mobility, visual, hearing, mental, or major bodily functions. So we must provide accommodations for that. Trained interpreters. A trained clinical interpreter will have knowledge of medical terminology in both languages, as well as training in the interpreter ethics and standards of practice. A trained interpreter will interpret everything that is said by both patient and the provider, without adding, omitting, or substituting. Trained interpreters have a much higher level of accuracy, so there are less errors. When interpreting, than ad hoc interpreters, family members, and staff. Consequences of not using a trained interpreter. Research done by the Agency for Health Care Research and Quality shows that LEP patients are at a higher risk for medical errors and tend to have longer hospital stays when trained interpreters are not used. Serious mistakes have been made in the past due to miscommunications that resulted from a trained interpreter not being used to communicate with an LEP patient. Misdiagnosis and unnecessary tests occur frequently when interpreters are not called. Medication and surgical errors are also very common. Here at Erlanger, we have noticed a tremendous decrease in this because we do use trained interpreters. And this is our language chart. These are the languages that we find here at Erlanger. So the top language, of course, the top demand is Spanish, and then American Sign Language, and then Arabic, Swahili, and Russian. You may wonder why Swahili, Arabic, and Russian. And that is because there are wars abroad, and refugees come to our country. We take our share here in Chattanooga. In summary, the implementation of language services has helped Erlanger Health Systems improve quality of care provided to patients. The evolution of our language services program has helped us provide the roadmap to implement needed services because of growth. Respect the patient's rights, which include their cultural values, beliefs, and preferences. Communication is a critical element of patient safety and quality care. Remember, providing an interpreter, either in person or with a phone or VRI, for LEP patients is required by law. Difficulty communicating means that the patient is LEP, and interpreting services must be offered. Family members cannot interpret. Language phones and VRI available 24/7 and should be used if the on-site interpreter is unavailable. Erlanger Health Systems is recognized as a community leader in healthcare and is an equal opportunity employer, committed to eliminating discriminating behavior in the workplace, provides a conducive, effective work environment for all personnel, encourages participation of all diverse groups in all organizational activities and levels. And if you have any questions, you can email Elizabeth Appling, Chief Diversity Officer, or if it's a language services question, you can email Carlos Salazar, Language Services Coordinator. Thank you.